The thing is, we're so high in our efficacy at 95% that even if it is reduced somewhat, we still will have an effective vaccine.
What is the difference between the COVID-19 vaccine and the vaccines that we're normally used to getting, like the flu vaccine?
Well, the vaccines basically work the same way. It's the COVID vaccine that we have now is a new concept, a new platform where they inject the mRNA, the stuff that makes the body produce the spike protein, which then the body responds to by producing antibody.
So we're not injecting the virus itself. We're injecting a material that mimics the virus so that the body can learn how to fight it off once it does actually encounter it.
Right, and it's only part of the virus. It's only the part of the virus that what we call codes for the spike protein. So it's that part of the virus that produces the antibody that prevents infection.
How well equipped are the vaccines that we're currently distributing for dealing with the new mutations of COVID-19 that we've seen?
Viruses just mutate as they transmit. Some viruses mutate a lot, like our flu viruses. Coronaviruses tend not to mutate quite as much, but some of the mutations have the changes right in the spike protein, which is the portion we're giving and the portion that the body needs to respond to. So they're checking it out to make sure that there aren't so much of a change to make the vaccine less effective. The good news is that it looks okay with the British variant, the UK variant, the South African variant. There have been a number of different reports. I think we'll have more definitive information soon. The thing is, we're so high in our efficacy at 95% that even if it is reduced somewhat, we still will have an effective vaccine. And the mRNA vaccines are relatively easy to substitute a new mRNA, which would code directly for the South African variant. And that's what Moderna is trying right now.
Historically, Black Americans haven't been treated well by a lot of institutions in the United States, the healthcare system being one of them with if you look at the statistical health outcomes. In your opinion, and obviously no one's expecting you to have all the answers in the world, but in your opinion, what should be done to address that natural skepticism surrounding the vaccine in certain communities?
Well, let me tell you what has been done. And that is that in the clinical trials, they have required that the African American, the Latinx community be represented in the testing. So there's no question that the vaccine is going to behave differently in these populations. Now it's a question of education and availability. And my big concern is the fact that with vaccine shortages, those who are more linked into the system may be able to get the vaccine more easily than those who are not linked into the system. And we have to be careful that the vaccine can get to the population that is not linked into the system, because that population is particularly vulnerable to the infection because they're living in crowded surroundings, less affluent surroundings, and that's where the virus has had its greatest transmission.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.